Good evening, friends and family. Today, my topic is teeth. So, I want to welcome new viewers, and I want to welcome back my friends and family, and to remind you to share, to like, subscribe. I know I'm not the best video in town, but my heart is pure. Now, in my youth, I did not take care of my teeth. Now, some of that I can blame on my parents, not having the proper dental care that I needed as my youth, and myself to blame in my teenage years because I was in charge of myself in my teenage years. But then again, it's hard to blame a parent when there's lots of us at home. And the dental industry is very, 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 very expensive. It boggles my mind that they even have a business. And we go when we are in dire need, when our gums are bleeding out of our mouth and our teeth are falling from our gums because we don't get the basic instruction that we need. I think it wouldn't hurt in our health classes in elementary school to talk about proper hygiene of your mouth, your teeth. Where does bad breath come from? It comes from a number of places, but I'm going to stick to one. It comes from bad gums and bad teeth. And there's a lot of products on the market that you can get to take care of that. Now, I have found that oil pulling is very, very good for pulling out the microfilm that causes tooth decay in your mouth. I myself prefer coconut oil. And yes, I do oil pulling even though I have dentures. So, I'm not going to go into all the nitty-gritty of proper hygiene. But I'll give you a few pointers. Start your children young. Teach them how. And find remedies that if you can't afford a dentist, you can afford to save your teeth. Nutrition is number one. Brushing and brushing and flossing. Keeping your tongue clean. Getting rid of that microfilm. You need to pull oil for about 20 minutes if you're capable and spit it out into a trash can. And all these things will help keep your teeth in good shape. I mean, pregnancy can really destroy your teeth. So you need to take the correct vitamins during your pregnancy. But that's not really my rant today. My rant is my dentist. I used him once, and shame on me for using him twice. Let me get a taste of my milk here. A little bit too late for my teeth, but it tastes good. Last year, I went to this dentist because I dropped my dentures on the floor, on the cement. And it broke my tooth right in half. I looked like one of those Beverly Hillbillies. And I was so embarrassed. And I went to the dentist to fix my tooth or to give me a new replacement, which he made me wait 9 weeks. And I tell you, I was against wearing the mask. But with a half a tooth, oh, was I happy. Masks were mandatory in most places. I still don't believe in the mask, but at that time I was thankful. So anyway, I'm sitting and I'm crying on my beer. I don't drink beer, but it's just a saying. And my son's girlfriend told me about a product. And I gotta put my glasses on now to see. It's called Temporary Tooth. Okay? It's a temporary tooth replacement product. It's easy to do and looks realistic. Smile again with confidence. I still got a lot of it left. It came with this little mirror. And I got my beads. And I got tweezers. And I got a pick. So we went to work on my tooth. Now, mind you, this is almost 16 months ago that I fixed my tooth. Not these, because I got them replaced. I got new ones. But my old ones, if you look real close, you'll see where I made my artificial tooth. Now, I could go back and fix it better if I wanted. And I might, because they fit me as well as these fit me. The only reason I fixed it would be so I'd have to get it hot in boiling water, melt it down, and then sculpture it to match my teeth. I think I kind of coffee stained it. But really and truly, I kind of got my confidence back. I knew the tooth was not the same, and I knew some people would notice, but not like having half a tooth. So I was pleased with my ugly tooth, and I wore it for about 4 weeks without problem. And you see, it's still in its place. So now I'm back at the dentist. And maybe a lot of you don't know that you think, well, if I pull my teeth out, then I won't have this pain, ugly teeth anymore. You have beautiful teeth like mine. They're not real, and they're very uncomfortable. And when the teeth don't fit right, they feel very heavy in your mouth, and they're very uncomfortable. Well, this bottom plate I have doesn't fit me anymore, because when you lose all your teeth, your gum bone goes away. It disintegrates until you have no gum at all. And I am to the point of no gum at all. So I made my dental appointment. Oh, I guess about 3-4 weeks ago. Paid him in full. Here I sit waiting for my fitting. I get to have my fitting in June. And he told me not to wear my teeth. In a few videos before this one, you will see where I am toothless, because I was obeying the dentist until he told me I had to wait until June before he would even look at my teeth again. I got 2 little bumps here, and he said, don't wear your teeth until those bumps go away. If they don't go away, then I'll have to do surgery. Well, I waited the 2 weeks. Now I'm 1 month in. The bumps are still there. And I do not believe that I want surgery. Okay? He's just going to have to give me my teeth as is. So, those 2 little bumps are going to make my teeth not fit right. Okay? And here I am, I'm wearing these teeth that just bounce around in my mouth. When I can't eat, they're causing irritation. But, you know, call me vain, but I really don't like looking like an old woman. I know I am. I'm somebody's grandmother. Not only that, I'm somebody's great-grandmother. But I don't want to look like it. You know what I'm saying? So, what do I do about that? I saw this advertisement on YouTube, and the people are pulling out their teeth and say, look, they fit, no glue, yay, yay, yay. I went, ooh, that's wonderful. So I go check the price, and for a tube of this stuff costs $79. I don't think I want to pay $79 for something I don't know about. So I went to CVS, and I got this. It's easy. My teeth stay in place, but I do have to use glue. But my teeth don't hurt me. My teeth are not heavy, and I can go almost all day wearing them because I relined them. So there are alternatives to the very expensive dentist that does not have time for you. But you have to do your oral hygiene. You know, you have to do what you have to do. If you don't know what to do, Google. Google is the greatest thing on earth to help you. Now, there are times you're going to need a dentist, I'm sure. But not all, and it's true, not all dentists are expensive like some of them. I remember back around 2007, 2008, my teeth, you don't even want to look at my teeth. I called how much to fix my teeth? $10,000. Man, I'm a poor little girl. I can barely make my electric bill and put food on my table. Where am I going to get $10,000? I can't afford to be in debt. If I can't eat, I sure can't pay a bill. So anyway, I kept shopping around. I had my SSI check coming in, and that would take care of my dentist. And with my SSI check and my back pay, I could afford $10,000, but I didn't want to. So I shopped around, and I found a place that cost $2,000. 2, not 10. They came in, they pulled out all the bad existing teeth, put the stitches in, and that afternoon they shoved in what I called my baby teeth. Oh, yes, it hurt. And I wore my baby teeth for about 6 months. And then they came in with my permanent dentures. And all this work cost me $2,000. And one time I was sick and I threw my dentures in the trash. And I had to go get new ones. And I went back to the same place that fixed my teeth. It cost me $500. This one right here, to get it replaced, cost me $800. And I have waited 1 month now, and I got 2 more waiting months that I know of, because they're going to come in, they're going to put their little plastic Dumaflachi they made, make sure it fits me right, and then they're going to send it off for another 3 weeks to get my teeth fixed. Well, I can't go without teeth that long. And I really and truly don't know why a dentist won't want me to do that. So I have to take the situation into my own hands. What can I do? How can I do it? I did it. Okay. And that's my rant tonight. I did it the first time, and then I gave the dentist a second chance, and I had to take matters into my own hands. I will get my bottom denture before the year is out. And if I use him for the third time, shame on me. Please like, please share, please subscribe, and wait for my next video. Who knows what Jeannie's going to talk about? This was my Jeannie fix. What is yours? Put it in the comments. Bye. Love you.